recorded, as it said, recording in progress. So it'll be recorded so you can get to it later, or those who were not on now can find it. I want to welcome you to Eden's Professional Development webinar this month. My name's Connie Burnham. I'm the Emergency Management Coordinator for the University of Missouri Extension Program, and I serve as the Eden's Professional Development Chair. And will serve as your moderator today. So please take a moment to drop your name and institution in the chat box so we know who you are with us today. We're going to be hearing today from Dr. Julie Smith. I've known Julie for many, many, many years, and she's always has great information. So anyway, I was glad that I was able to capture some of her invaluable time because I know that she's very, very busy. And I'll give you a little bit of information about her and about her webinar just in a minute. The evaluation seminar, survey link will be in the chat box, and please make sure that you complete it. We all know, you know as well as I do, how important evaluations are for the work that you do. And so we want to make sure that those who have taken the time to develop a webinar and give us their time, that they get feedback from the webinar that they're going to be seeing today. It's being recorded, as you heard, and be mailed out and posted to Connect Extension under the Eden subgroup and the Eden YouTube within a day or two. So the evaluation link will also be included in that. So anyway, let me give you a little bit of background now. So we're going to be talking about, well, the name of the webinar is One Health Issues Take Wing. And it's a framework. One Health is a framework for advancing health globally by understanding the interdependencies between animals, humans, and their environments. In this webinar, we will zoom in on two airborne issues, screwworm, that's been a real popular discussion recently, and avian influenza. What should we know about how flies and flying birds can attract or affect the health of animals and people? Julie Smith is a veterinarian and animal scientist. She conducts research and outreach to benefit animal agriculture industries in Vermont and across the United States. Her recent efforts have been focused on emerging and emergency diseases of livestock and poultry, emphasizing the importance of awareness and prevention. Through multi-state and multidisciplinary collaborations, her projects address animal health and how to minimize the spread of infectious diseases in animal production systems. She has been with the University of Vermont since 2002 and a long-time member of the Eden Agriculture and Agro-Security Committees. So again, welcome you, and thank you so much, Julie, for taking your time.
Well, thanks so much for the invitation. It's a real pleasure to be with my colleagues in the Extension Disaster Education Network and talk about an issue that I think is of importance to us in this country. And I have, as a starter image, a quiz question for y'all. So you can put in the chat, what is this a picture of? What is this a picture of? And I expect some of you have seen a picture or a video of this sometime. Let's see who's got it here. Oh, we've got yeah, we've got it. Joanna got it. A murmuration of starlings. This is called a murmuration. And I chose this picture as the starter illustration for this talk because a murmuration is illustrating something that's flexible, adaptable, it's up in the air, it's kind of magical, it's kind of out of our control. Certainly would be challenging to control, as are the diseases and pests that I am talking about today. And I am talking about them, and we're talking about them in a One Health framework. So I will eventually get to a definition for those who aren't familiar with One Health. But if any of you are familiar with One Health and have been doing activities in a One Health manner, I'm wondering if you could just put in the chat what kind of issues you have been addressing with a One Health approach. And along with the what is the issue, if you can say who else was at the table. So have you been dealing with any issues with the One Health approach, and who have you been collaborating with or assisting in those efforts? All right, we've got some animal diseases coming in. So bovine brucellosis, you got to work with the ranchers themselves, public health folks, wildlife managers. Excellent example of applying a One Health approach. And maybe some of you have other things, or maybe you just want to learn more about it. So we're going to move along here, and I'm going to raise my umbrella next. This image is from One Health Sweden, and it's, to me, a helpful graphic to remind us that One Health doesn't define an issue, but it's an approach. And the approach bridges multiple disciplines. So if you look at any of the disciplines up under the umbrella, these are the types of health-related disciplines that might be working together when there's an issue that should be approached through that multidisciplinary lens. And then some examples of different things are shown below. But I want to use a video from the Centers for Disease Control to introduce the concept. Even though this is an older video, it does a nice job of introducing the concept and where it applies. Okay, so that is our introduction to One Health. And now I have a definition showing here that comes from the Department of the Interior. And I really like this framing of One Health. And this describes One Health as a collaborative, multi-sectoral, and transdisciplinary approach. So that means it's not one field, one person can carry the flag, right? So you have to work together with people with different disciplinary backgrounds and at different levels. So by multi-sectoral, we're talking about different levels of government working with industry and working with academia, working with extension. So all of these folks need to come together. And the goal when working in this way is to achieve optimal health outcomes. The approach recognizes the interconnection between people, animals, plants, and their shared environment. I really like that this definition remembers plants are part of the picture. I, I include plants when I define biosecurity. So it's a one biosecurity approach, and I think One Health benefits from looking at all living things together and the shared environment. And this approach can be uh, useful, right? So that it's when there's a complex issue. Complex issues call for a One Health approach. Complex issues like zoonotic diseases, emerging infectious diseases, of which we have had several in the country recently, antimicrobial resistance, an ongoing complex issue, and other threats to ecosystems. So here's the outline of where I'm going with you over the next few minutes. Because the expertise I bring to the table is animal health and disease prevention or biosecurity, I'm going to start with an overview of signs that actually are indicators that it's time to call a veterinarian. And then I'm going to talk about what I think we need to know about avian influenza and screwworm to support One Health efforts through our positions in extension or academia, and discuss some other opportunities related to this, where I think the Extension Disaster Education Network can provide valuable contributions. So first off, baddies. Where did this come from in the first place? Well, these are an adaptation of an acronym that was developed through the Georgia Agro Security Project, I think over 20 years ago, and then modified through the advice of Nat Tablante, an avian veterinarian and longtime Eden member. So we rebranded the acronym BADDIES to stand for different clinical signs that animals individually or groups show that mean that there's something going on that's maybe a little more serious, and it's time to call a veterinarian to find out if it's just something serious that's commonplace or if it's something that needs to be distinguished from a foreign animal disease or pest through diagnostics, through a foreign animal disease investigation. So the first B stands for blisters or vesicles, and these are signs that can be caused by many things, but one of among the diseases that could cause this are some foreign animal diseases, which is why they always rise to the top of list of concerning clinical signs. The A stands for abnormal eating. This can look a lot of different ways. It can be loss of appetite, it can be drooling, it can be difficulty swallowing. That last sign could be a sign associated with rabies, a zoonotic disease. So certainly something that we want to make sure we get a diagnosis of or rule out that it's not that. The first and second D can use them interchangeably, but one of them is related to seeing an unusual number of or unexplained deaths and downer animals, animals that are unable to walk. The second D is an unusual number of animals or an unusual age group affected by diarrhea. The I is the most non-specific sign on the list, signs of illness. Well, are you seeing an unusual presentation of sick animals, an unusual number, a lot of abortions? How did we figure out what was causing the mystery disease in cattle a couple years ago and determine that it was caused by an avian influenza virus? People brought that to the attention of veterinarians, and eventually the diagnostics gave us the answer. The E stands for exotic ticks or maggots. One of those will be featured in today's presentation, but we worry about some pests. Most of the time we worry about flying pests or crawling pests that bite because they can transmit disease. In the case of the screwworm fly, we're worried about the fly itself and its life cycle as the cause of harm. The final S is for staggering, which captures a lot of different presentations related to neurologic illness. So you could see staggering, spasms, seizures, could be a lot of things. One thing we don't hear much about anymore, but back in the 90s, we started to recognize that mad cow disease was a problem, bovine spongiform encephalopathy, and it caused neurologic signs as a clinical presentation. So with that as background of things that folks in animal agriculture need to be looking out for and when to call a vet, we're going to talk about a couple diseases that affect not only livestock, but can have implications for human health as well. We're going to start with avian influenza. And I'm going to try to keep this simple. You could talk for an hour just about influenza viruses and what they are and their types and how they work and how they cross over between different species, but the overview is illustrated here. So avian influenzas that can cause type A influenza in humans, all derived from an avian influenza virus at some point. Migratory water birds, the wild waterfowl, fly over every year and they bring with them new viruses. Um, Most of the time, these viruses are host adapted to the wild birds, so they don't actually get sick from them, but they can leave virus behind that can infect domestic birds, especially hens and turkeys that are domesticated birds for human consumption. And depending on what strain it is, the birds may just have a small illness or they may get very, very sick and die. The same virus can infect people or pigs, but people and pigs also have their own influenza viruses that are circulating among their populations all the time. And this is where things get interesting because if we, for instance, personally are harboring an influenza virus that's going around and we get infected, co-infected with a novel influenza virus, those viruses can do a little dance inside our body and recombine. They can exchange genetic material and recombine into a new strain. And the concern then is if it's a strain that can spread from person to person, it could trigger the next pandemic, right? So this is the story of how things work and where the risk is. And it's not like every time a virus gets in, it's going to end up being a pandemic, right? It's been quite a while since we've had a major influenza pandemic, but they do happen. I was reminded the story came on the air, I think it was during COVID that they were talking about the avian influenza outbreak of 1918, 1919. A lot of people refer to it as the Spanish flu outbreak. And among other things, that outbreak interfered with the Stanley Cup final in 1919 and the final game because they were tied 2-2. Canadian Montreal's or Montreal Canadiens and the Seattle Metropolitans tied 2-2. They were going to have a final game. Enough team members came down with the flu, like wicked sick with the flu. It was a really bad flu that they canceled that game. So bad things can happen. Mm. So what do we need to know about this? Why does this screen say HPAI? Well, with HP, we have a highly pathogenic strain of avian influenza. A highly pathogenic strain means that it will be very likely to kill a lot of domestic birds that are infected. The interesting thing about our current strain of HPAI that has been brought in by wild birds is that it's killing the birds too, which is quite unusual. So it can be a threat to human health if you are exposed to a highly pathogenic avian influenza. You're not going to get it through the food. The food is safe, but being exposed to animals or other people with the virus could be a problem. What happens in birds? The the characteristic sign is you walk in the house, the hen house, and all the birds are dead. You may see decreased production coming on ahead of that. You may have seen a little bit of signs of respiratory distress, but HPI can move really fast through birds and through flocks. So it's bad. How do you prevent it? So our poultry flocks, especially the high genetic flocks, have very, very strict biosecurity. They control access. They make sure people accessing the facility have followed protocols to do the best possible to ensure they're not tracking any contamination in from outside the facility as they enter. Some of these buildings have air filtration, so things can't come in on the air. That's usually the weak link on these facilities because the virus can become airborne on dust and other things that could blow into a building. Um, so biosecurity is about the only thing that we can do. Also keeping wild birds away from facilities that we have domestic birds in. And I'm going to try to jump into the chat at the end to leave you links to some resources. So that's the usual story of avian influenza when it's, how would you say, stays in its lane and it's mostly affecting avians. The current bird flu in the US and around the world has been a little different. So we're dealing with a highly pathogenic strain of an H5N1 virus, and it's a particular clade. It's like the subgroup of this virus, the genetic type of this virus, 2.3.4.4b, that has been really interesting. And there's two genotypes that are present in the US. We had a lot more of the B3.13 last, well, 2 years ago. Um, that genotype brought in a huge adaptability of the virus to infect multiple species. So not just multiple species of birds, which was a bit unusual, so a variety of bird species, but also many mammalian species. Oh, I think over 40 mammalian species. And so interestingly, when it got into cattle, one of the other things that was being reported on these the farms with the infected herds was that they'd seen cats, wild, just their farm cats dying or having neurologic signs. So the virus was affecting the cats as well. More recently, another genotype has come in. It also has been found in birds, people, and cats, and some cows. More sporadically in cows, hasn't been spreading herd to herd like we saw with the B313 initially. Um, but people are always keeping an eye on the genetic changes in the viruses and trying to figure out how close they are to something that could be more likely to be a problem in humans. And so far, these don't have a lot of human-like signatures in them, um, but we're still trying to be cautious. This particular H5N1, if it hasn't been made clear already, has been more virulent, meaning more deadly, and more likely to cause disease in animals that are affected. And one of the concerning things about it is that, um, in addition to being affecting a wide range of species, is that it's stuck around. So we've been dealing with this H5N1 since 2020, and that's pretty unusual. Usually between a couple migration cycles, we're dealing with a totally different virus. But this one has been around for 6, going on 7 years. So it's been around for a while. And as we are seeing resistance to antivirals in our avian influenzas in humans growing, there's a concern if this H5N1 did some reassortment with a human flu strain, could that be resistant to antivirals? So there's some concern for human health, whether there's pandemic potential or not. We're always keeping an eye on that. But it's why I've put the human in this picture, because this is where that One Health concept comes into play, where we've got a virus that comes from the environment. If you call the wild birds the environment, can get into domestic animal situations that humans are responsible for caring for, and the humans can get sick. Um, since April 2024, the CDC has confirmed 21 cases in the US. Doesn't sound like a huge number. There's probably a huge underreporting of cases that just aren't confirmed. But of the confirmed cases, 41 were linked with exposure to dairy animals, 24 to poultry, 3 to other animals, and 3 unknown. And you can find out more about what's going on the human health side through the CDC website. But this concern about virus from domestic animals coming into the humans caring for them led uh, led the development of a project here at UVM where we wanted to ask the students who are responsible for milking cows in our teaching herd to try on different types of eye protection and let us know how it worked. What you see on the right side of the screen is the PPE recommendation for milking workers, people milking cows in parlors, that the CDC has put out. And you see they've got quite a lot of personal protective equipment on. And I don't know if any of you have seen somebody milking cows wear PPE like this. I can tell you I have not. And even my friends who have been involved in research projects collecting samples from cows that might have avian influenza said that a lot of times if you took a picture of them, you would find their goggles pushed up on their forehead. And those are people who know. Our students here, to engage in a research project, it's voluntary. They are not required to wear this level of PPE to participate in class. And we don't have a history of the H5N1 in dairy in our state. And we have had very poor cooperation with students to even just try them on to try it because we have different styles. We want to see what's comfortable. We want them to wear them for a shift, just one shift, and tell us, did they fog up? Were they comfortable or not? Did they get covered with splatter? What were the problems? Because we want to figure out how to make it easy as possible for farm workers to protect themselves. For the people who have gotten avian influenza from dairy cattle, usually their signs are mild, conjunctivitis or pink eye, upper respiratory signs, some coughing. Um, but the H5N1 does have a history of killing people. And so it's not to be taken lightly. So I just want to pause and see if there are any questions about avian influenza that should be answered before we move on.
I don't see any, excuse me, but if
Okay.
anybody has one, jump in there really quickly.
Okay, thanks, Connie. And certainly if you have questions, I'm hoping to have time at the end for questions, so we'll come back to that. So we're going to move on to screwworm, and before we do, I just want to ask, and here I want you to put something in the chat, see who's out there. I want to know, how concerned are you about screwworm? So just come up with one word that describes how concerned you are about screwworm, whether you're hearing reports, whether you live somewhere where you think you should be concerned. How concerned are you? Take a peek here. All right, some want to know what it is. Some are moderately or very concerned. Ooh, some highly concerned. Um, I would say, right, okay, so maybe concerned, but maybe not so much locally, and that's kind of where I sit. Um, maybe not as concerned up here, but maybe I should be. So let's all get to know screwworm and why people are talking about it more than they have for 70 years. So first off, is it a human health concern? Yeah, it can be. Can be. Um, Usually it causes a lot more devastation in animal agriculture and potentially wild animals, but could be a human health concern too. Um, I might as well explain now why it's not usually as much of a human health concern. Um, People in the US are generally pretty clean and pay attention to what's going on in their body. Um, so if, and we hopefully have the ability to cover up wounds, um, and things like that. So the issue is more for people or animals who are exposed and may have wounds, um, exposed mucous membranes, um, fresh umbilicus just after birth. Um, the newborns are at higher risk because they're not um, maybe as able to protect themselves as older animals. Um, but older animals have some issues too. I'll explain that with another slide. What do you see in animals that are affected by screwworm? You may see signs early on. You may see an egg mass. It starts with eggs being laid in a wound or on a mucous membrane. You may smell something. This is a sign that the eggs have hatched and larvae are burrowing into flesh. So there may be a really foul odor. The animal may exhibit signs of pain. Is it preventable? Um, we'll talk more about some countermeasures that come into play to control screwworm. But at the ground level, kind of where I want everyone to start, is to be able to detect it as quickly as possible and know how frequently to be observing animals to make sure that we can detect any problems early on. And I've got some resources to link to later. So the New World screwworm is not all that new, and I've got this great video that I hope will play for you today.
We need to talk about one of the most terrifying parasites on Earth for a moment. Don't worry, we won't make it too gross. Cochleomyia hominivorax, which literally means the man-eater. The New World screwworm fly at home in the Americas. Each of these metallic blue-green flies with bright red eyes that exist in nature is here because it's feasted on the flesh of a warm-blooded animal. Cochleomyia can detect wounds and smell blood across vast distances. If a human, a deer or a squirrel has the tiniest scratch, female screwworm flies will try to lay eggs in the wound. When they hatch, the worms start eating healthy flesh with sharp mandibles, causing horrible wounds, attracting even more flies. In serious cases, the animal will die or at least be severely weakened. Cochleomyia doesn't add anything positive to the world and is a natural enemy of ours. For most of history, this parasite was simply a horrifying fact of life in the Americas.
Sorry, I'm wrestling for control with the video. Are you seeing the slide that says New World screwworm?
Yes.
Awesome. So fun fact, bright green fly with red eyes. Does that remind you of any other kind of fly we have normally in the US? Your common blue bottle fly, some other caliphorids, and up where I am, the cluster fly is related to the New World screwworm. Fortunately, we haven't seen this beast. Here's the actual spelling of its Latin name. Fortunately, we haven't seen this fly in the US for about 70 years. And it has been confined to South America since 1997, for the most part. But you can see illustrated here how long it took to eradicate the New World screwworm from North and Central America, starting in the 50s. So from the 50s to 60s, worked it back to Mexico, through the 70s and 80s, worked it back to further south in Central America, and then through the 80s and 90s, got it all the way back past the Darien Gap. Unfortunately, it's a lot of effort, right? So that took 40 years to eradicate, and it's been a while. So other than the little incursion in 2016 that we'll talk about in a minute, last September, to find the screwworm 70 miles from the southern border, so 70 miles from a border of Texas, was a bit alarming. So it succeeded in getting past the Darien Gap a few years back and working its way north. And now we got to figure out how to reverse that. And we think we can do that. We've done it before. Most recently, we eradicated screwworm from the Florida Keys. So that incursion in 2016 was in the Florida Keys, and it affected the key deer, an endangered species. And it came in around their breeding season when the males fight each other, leaving wounds which were quickly infected by the screwworm fly, and decimated the male population of key deer for that year. They are coming back, but it was a problem. Only one domestic animal was found with screwworm during that episode. Stray dog was brought into a vet clinic south of Miami, and that was the only place that it seemed to have gotten to on the mainland. And how was it controlled? It was controlled by the release of sterile male flies, and I'll explain why that works in a minute. Oh, here we go. We're going to explain it now because it is related to the life cycle of the screwworm. So if we start over on the left side with the adult fly, the female fly, after mating, goes and she smells where she can lay eggs, and she goes and lays 300 or so eggs in one spot and does that in a few spots. And those eggs will hatch out into larvae. They molt a few times, and after you get to the third instar, that larva pupates, and the pupae drop from the host. So from egg to pupa takes about a week, 5 to 7 days. And then you've got pupae on the ground that take anywhere from a week to 8 weeks to hatch. So depending on environmental conditions, those eggs might hatch out right away, or they might hatch out over a few weeks. And then you have adult flies emerging. The female mates once and then lays eggs. One female can lay up to 3,000 eggs, but she doesn't live very long. So the female fly lives 10 to 30 days, right? And mates once. And that is why the sterile insect technique works so beautifully. People figured out a way to raise the screwworm artificially in a laboratory and ensure that only male flies are hatched out and make sure that the male flies are sterile. And then you release millions of them in an area that's been infested with screwworm, and you hope that the females mate with the sterile ones and not with the fertile ones, so that if she lays eggs, they don't hatch. And that brings the infestation under control. Right now, there's a production center where they grow screwworms, grow the sterile male screwworms in Panama. It's far away, and it only has a certain capacity. And obviously that capacity was overwhelmed because the capacity was designed to meet the narrowest point of Central America. So more production facilities are coming online, will come online, one in Mexico, one in the US. Right now, we have more dispersal centers helping to disperse the flies that are being developed elsewhere. So one of the centers is in Chiapas, Mexico. That's the Tuxtla Dispersal Center. And the other center that came online in February of this year is at the Moore Air Base in Texas. The Moore Air Base has plans in place to also be a production center. The production is not online yet, but hopefully that will come soon. So that is the major countermeasure will be through sterile insect release. Texas also has a lot of traps deployed. They're a little bit controversial, but in areas that have known infections, it can be helpful to have a trap to attract the females to so that they are infesting fewer animals. There's some concern that they may attract flies to areas where they aren't already. So it's best if they're used in combination with the sterile insect technique. So where do we fit in with this? So those of us in extension and academia, where do we fit in? And I am going to propose that the main place where we come in is communication, and that this is a risk communication. There's a lot of uncertainty. We may or may not be in an area that ever is affected. Should we know about it? I think so. Are there people in the community who maybe should know about it? Probably. So I want you to think about right now in your community, who do you think is what population or group is the most important group to know about screwworm? Who should know about screwworm, be paying attention to it, be ready to do something? Who would that be in your community? We're going to see if somebody is putting in a response. All right, we got some responses coming in. Thanks, Danelle. Animal owners, hunters, 4-H. Okay. 4-H volunteers, 4-H youth. Are there other folks in your community you're thinking of? Right. Veterinarians. Great. So our animal health folks, hopefully our public health folks, producers. Yes, producers, feedlots. Thanks, Scott. I'm also thinking maybe town managers. People have to look out for for all people in their town, right? What do we want to focus on? What are the most important things for people to know about who may not actually directly do something about screwworm? They should know what to look for and who to report it to, right? Those are like the most important things. And thinking about vulnerable populations, right? We can protect ourselves, we can protect our livestock to some extent, but many of us have members of our communities who may not have a roof over their heads, right? We may have animals that don't have barns, and we're dealing with a disease issue or an infestation issue that we need to be examining animals twice a week if we're going to make sure that we are ready to observe things early on. We want to try to catch this before any pupa hit the ground. That to me is the goal. All right, so how do we communicate? A risk communication. I recommend a model called the IDEA model. This has been developed by risk and crisis communication experts Tim and Deanna Selnow, who are now based at Clemson. This model is evidence-based and easy to use. It empowers people to make informed decisions, and these decisions, hopefully, will take them in a direction of applying appropriate protective actions. And that will protect their health, the health of others, and minimize consequences. It's an acronym, stands for internalization, distribution, explanation, action. And I'll walk you through this. The internalization piece is what I see as the most important piece. It's how do you get somebody to care? How do you get them to see why it's important to them and to people or animals that they care about? How could they be affected? The second piece, so we're going to skip to the E, the second piece that's important in the message is an explanation. What is this thing? What is important for me to know about it? What might I want to know about it? What might I get wrong if you don't tell me, right? So there's some explanation, and the A is for the action. What do you want someone to do, or what do you want them to not do that will be beneficial in this situation? That's developing the message. You have to get the message to the people who need it through appropriate distribution channels. And that's where the D, what the D is for in the idea model. So sometimes we have public health, animal health folks posting things on a website. That's where they're posting the situational awareness. Not everybody's going to the state website or the USDA website or CDC website for information every day. We can pull that information and put it in channels to our clientele, to our communities, to get that information to them. So understanding how people are using social media, different modes and methods of getting messages, that's where we want to get the information. All right, how are we doing for time? We're gonna.
You've got 12 minutes left to the top of the hour, and if you want to pause for questions, yeah, just keep that in mind. And I was about to share the link for the evaluation before people start jumping off at the end of the hour.
All right, why don't you go ahead and share that link, and I'm going to skip the next couple slides. These slides are, in case anybody's wondering, they're steps that are involved in enhanced biosecurity, and it's kind of a quiz. So if anybody wants to visit with me about the quiz and which of these biosecurity steps would be useful in preventing avian influenza or screwworm, happy to talk with you later. There's 12 or so different biosecurity measures that, or categories of measures that could be called on. Where I want to go is, again, to help you get more information. So there's a great website on avian influenza on the USDA site here, which I will get into the chat. And there's another one on screwworm. These are really great resources. Whether you point to the resource or just pulling information from those resources into your communication channels would be really useful information. A series of videos that we produced right here at the University of Vermont were designed to illustrate answers to hard questions about foreign animal diseases. And foreign animal disease incursions also include foreign pests. So we've talked about an example of a disease and a pest today. Avian influenza and screwworm both fall under the category of being a foreign animal disease. And some of these topics may be of interest to you related to these diseases or just for general preparedness. We have a set of 11 videos, and they are listed with 12 titles. So just to give you a sense of what they cover, one is covering general disaster preparedness for farms, then introducing the concept of an enhanced biosecurity plan, how a map supports an enhanced biosecurity plan. We have a mapping app in development that will simplify the process of drawing that enhanced biosecurity plan for folks that are doing secure food supply plans. We have another video on the difference between everyday and enhanced biosecurity, answering questions of why worry about these things in the first place. I encounter a lot of people like, well, that disease doesn't exist here. It's not in the US. Why should I worry about that? And then all of a sudden one shows up, right? And so we do need to talk about these things and think about it and think about why we can't always catch them at the border. We have a video about what is being done for monitoring things and preventing things from crossing the border. Things that fly are harder to stop at borders. Little backgrounder on disease spread modeling that relates to, well, how do we stop and slow disease? And how do we model the effectiveness of different things? Disease surveillance and detection plays a role. assessing and managing risk on farms obviously plays a role. The role of removing susceptible animals, whether it's through vaccination or isolation, and then the relationship between control areas and continuity of business. All important topics. So that concludes the slides, and I'm happy to take questions, and I'm going to pop a set of links into the chat for you all. All right. And you'll see some of these are on avian influenza and some are on foreign animal disease, and where you can get more information from projects that I've led, the Healthy Farms, Healthy Agriculture website, which is producer facing. And then there's information on other projects that I've been involved with on the Secure Agriculture website. And I'm happy to take any questions.
Yes, please step forward because Julie will have the answer for you. And again, I want to thank Julie because she's stellar in the work that she does. So, do we have anybody? No, I don't. I don't think we have any questions, Julie. But if anybody else has, here, I guess I could make myself known here by my face here instead of the black box. So anyway, but make sure that you fill out the evaluation and, all those links and everything. And I know that, if you responded even directly to her, she would be more than happy to converse with you and spread this video out, share it with many, many other your colleagues, either in your college or in your program or outside. Just make sure that other people get to see this because it's really, really a good one. Now, next month, we're going to have one that's directly related to screwworm. And that's why I said, man, after I realized Dr. Dozier said, I asked him, I said, so who, and he's the head of Eden right now, he's the chair. I said, so how does that affect, or who does that all affect? And he says, anything that's got skin. I went, okay, all right. So that pretty much shows that it is a very, very, very big issue. And so the more that we learn about it, the more that we can hopefully diagnose and some kind of treatment for it. And what you were talking about was very interesting to me. So are there any other comments?
I see a hand from Danelle.
Yeah.
Oh, there
Julie,
we go. Okay.
thank you. Hi, Julie. Danelle out in Wyoming. And I'm just interested. I know you guys do so much work there at UVM thinking about the behavioral aspects of helping control disease. So I'm just thinking about concepts like people feeling either like afraid or ashamed to raise a question like, hey, I've got something on my animal and I'm not sure, it's probably nothing. Just any thoughts you have about how to encourage people to overcome those feelings of, again, either like fear that, oh my gosh, if I have it, what are the consequences going to be for my operation, for my neighborhood, for my industry? Feelings of embarrassment or shame if it's nothing. What do you think?
Yeah. No, all of those feelings are likely and real and challenging in the sense that it can cause hesitation and delay in reporting. And in my work, and certainly the federal veterinarians who I work with, they emphasize over and over again the fact that most of the time what we worry about, it's kind of what my husband said, most of the time what we worry about doesn't happen, right? Like there's a lot of signs that we have to do the diagnostics to rule something bad out. But most of the foreign animal disease investigations that are done every year are negative. right? Like we're doing hundreds of investigations. So please join the club, do an investigation. Hopefully you'll be among the many negatives. But if you're not, hooray, you have helped us find something quickly. And then we can bring in the other supports. Like there are other support networks we can connect with people. But the early detection is so important that we try to get people to feel good about doing their part in that, even though there's other parts of it that feel really bad.
No, I love that kind of putting the superhero cape on them, that they're helping their industry by
Yeah.
catching anything early. That's a great tip. Thank you.
Any other questions? Well, I've really enjoyed the interaction, and I'm hoping that somebody can save the chat for me because I'd love to have some of those responses just for my information. And I'm available if anyone wants to email me at any point. So thanks again for letting me have this time with you today.
Thank you. Reagan, will you save the chat?
Yeah, I was just going to chime in that I
Okay,
will
good.
look for that and I'll send that over to you, Julie. Thank you so much.
All
Thank
right.
you.
All right. Remember, May 12th, we'll be back with another webinar, and we hope that all of you will join us and spread the word so that others might join us as well.